from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back. 6:24 is the time. Are you getting enough sleep? If you've struggled with good sleep for some time, but is enough? Are you ready to do something about it? Well, maybe see a sleep specialist. Joining us this morning is Baptist Health Dr. Devon Ballard from Sherwood Family Medical Center. He's going to tell you if you need to see a sleep specialist. Let's start this morning, Dr. Ballard, with someone who says that they're having trouble sleeping. What are some of the key factors that could cause something like insomnia? That's the word we hear all the time.
So there's like 80 or 90 sleep disorders, but insomnia can be from a multitude of things.
Okay.
It could be from stress itself, mood disorders like depression, anxiety can cause insomnia. Having kids in the bed or kids waking you up can cause insomnia.
Children in general, yes.
As most parents know.
I'm familiar.
People with sleep apnea get can have insomnia at times or have excessive daytime fatigue. So insomnia can be from a multitude of things. Some people drink too much caffeine to help supplement, which can exacerbate and cause insomnia later in the day. And so nutritional intake can cause insomnia. So there's so many multitude of things that cause sleep disorders and insomnia. Very common. See it all the time.
Well, let's talk about someone who finds himself during the day getting sleepy. And this isn't a one-time thing. It's a consistent thing. What are some of the things they need to be aware of? When is it time to go see a doctor? When do you say, like, oh, I need to eat better or sleep more at night? But when would it be time to say, no, this is a real problem?
Correct. So let's say you don't get a good night's sleep because your 6-month-old wakes you up. The next day you're going to be tired, right? That's or a mother that's breastfeeding every 4 hours, they're going to be tired after a month. And so they're going to be want to take a nap periodically. However, there is something called excessive daytime sleepiness or excessive daytime somnolence, which is a factor that we usually want people to get a sleep study because sleep apnea or narcolepsy can cause, in essence, if you're moving around, your brain is awake, right? You're walking around doing stuff. However, when you get into a recumbent sitting position, your brain, it almost gets like narcolepsy. It shuts off. And so people will be moving around and then sit down at the office desk and fall asleep. Or you try to go watch a matinee movie on Saturday at 3 o'clock in the afternoon, and your partner's out. And so literally they're sitting there. It's classic that they're like, oh, they always fall asleep in this recliner or that recliner. And that can be a precursor to sleep apnea, which can cause significant health issues, blood pressure issues, heart disease issues, increased stroke issues, and driving issues. So just on the side, if you're going to drive an 18-wheeler and you're an 18-year-old that weighs 150 pounds, guess what you have to get before you get a CDL license? You got to get a sleep study. Period. That's a requirement for CDL license because they don't want somebody with undiagnosed sleep apnea driving an 80,000-pound rig down the road in Kansas at nighttime and you fall asleep and crash. So actually some professions require a sleep study, period, before you can even do that job.
Well, we could talk about sleep all morning here on Daybreak. It's something we talk about on a daily basis, the lack of it here for this shift. Maybe you feel the same way at your job or whatever you do. If you would like to contact Baptist Health, go to baptist-health.com. That's where you're going to find all the resources available to maybe get a sleep study at Baptist Health or go talk with your primary care physician about setting one up. You can call the Baptist Health Line at the number on your screen. Dr. Ballard, thanks again for stopping by. We appreciate it.